Hi, I'm Jessica Leonard, and today I'm going to be going over prenatal teaching for a healthy pregnancy. The way we start is going into our patient's room. We close the door behind us for patient privacy. We're going to perform hand hygiene, and we're going to verify name and date of birth. Get our 2 patient identifiers. Okay, hi Mrs. Jackson. My name is Jessica. I'm your nurse today. I understand that you're newly pregnant, and today I wanted to go over what to expect with your pregnancy and how to maintain a healthy pregnancy for you and your baby. Is that okay with you? Okay, great. Since this is your first appointment, I'm going to start by talking about your last menstrual period, and with that we'll calculate your due date. We're also going to discuss family history. We're going to discuss your medical history, and we're going to discuss your lifestyle. We're going to get your blood pressure, your height and weight. We're going to do a complete physical. We're going to do a pap smear, a pelvic exam. We're going to do STD screenings, and we're going to do a blood draw. We're going to get your blood type and see if you're Rh positive or negative. Let's see. We're going to get your overall health and screen you for HIV, syphilis, rubella, and depending how far along you are, we can do an ultrasound, and that would be either internal or external depending how far along you are. We'll do an ultrasound. And then after this appointment, we'd see you about once a month until you're 28 weeks. From 28 to 36 weeks, we see you every 2 weeks. From 36 weeks until you deliver, we see you once a week. Every appointment, we'll do your blood pressure and your weight. We're going to measure your belly and your fundal height, and that ensures that your baby's growing how is expected. We'll always listen to your baby's heart rate with a Doppler. Some special tests around week 20 is an anatomy scan. It's a detailed scan of the baby to make sure everything is forming correctly. And we can also determine the sex of your baby if that's something that you'd like to know. Between weeks 24 and 28, we do a glucose tolerance test. We check you for gestational diabetes. Between weeks 36 and 37, we do a group B strep test, and if that's positive, you can expect to be on IV antibiotics at delivery, and that's just to protect your baby from that. Now I'd like to go over nutrition in pregnancy. You really only need 300 extra calories per day, and that should start the second trimester. And a little bit more than that when you reach the third trimester. You just really need a good balance of good nutrients and vitamins. So we really want to see a good incorporation of protein. So that's your poultry, eggs, fish, even beans. Carbohydrates, we'd like to see whole grains, and that's going to be quinoa, oats, fruits and veggies, brown rice. For your fruits and veggies, do a lot of different color varieties and dark leafy green veggies. We want to see a good balance of healthy fats. So those are going to be seeds, nuts, avocado, olive oil. For dairy, that's milk, cheese, and yogurt. We want to be careful and not have any unpasteurized dairy. No undercooked meats or veggies. Please avoid all alcohol. For supplements and vitamins, we want to incorporate folic acid. It's going to be 600 milligrams of folic acid, and you can find that in your leafy greens or fortified cereal. Other supplements that we want to look for are iron and calcium and vitamin D. The iron's good for oxygen in your red blood cells, and the calcium and vitamin D are for strong bones for both you and your baby. So your doctor's going to probably prescribe some prenatal vitamins, and those are going to supplement your good dietary intake. Another thing we want to pay close attention to is hydration. So that's really important, and what's recommended is going to be at least 3 liters of water a day. And then exercise. The current recommendation is going to be 15 minutes a day of moderate aerobic activity. If you don't exercise now, you can start slow with walking and light aerobics and work your way up. You don't want to get too excessive with it. You want to keep healthy. So keep safe and healthy. And some good exercises would be swimming, walking, and yoga. You're safe to continue an exercise regimen that you've already been doing as long as it doesn't have risk for falling or any trauma to the abdomen. So for weight gain, we want to have a healthy weight gain based on your pre-pregnancy BMI. So if you have a BMI less than 18, that's underweight, and we expect you to gain 28 to 40 pounds total. Normal weight is 18.5 to 24.9 BMI, and we expect 25 to 35 pounds of total weight gain. Overweight is a BMI of 25 to 29.9, and we can expect 15 to 25 pounds of weight gain. And then a BMI of over 30 is obese, and we'd have to limit the weight gain from 11 to 30 pounds. 11 to 20 pounds of weight gain. Some symptoms you might encounter are vomiting, nausea, kind of morning sickness type symptoms. We suggest frequent meals and upping your protein. You could add some ginger or ginger chews or like ginger ale. Those are really helpful. Some other complications would be constipation. Hormones released during pregnancy kind of slow down your digestive system, and so constipation is kind of common. Ways to help this is to get your body moving, and that usually gets your bowels moving. Also increase your fluid and fiber intake. Fiber would be like ground flaxseed or prunes. Those usually help with that. Another common thing that we see is heartburn or acid reflux. So same with the nausea. We tell you to have frequent meals and maybe the ginger. You might want to prop yourself up with pillows or foam wedges, and definitely avoid trigger foods like spicy or fried foods. For warning signs, I really need you to call your provider immediately, is if you had severe abdominal pain. This could be a sign of ectopic pregnancy or miscarriage, or a placental abruption. Some other things, it could be unrelated, maybe like a gallstone or uterine growing pains, but it's definitely important to get that checked out. Another thing would be swelling in your face, your hands, your feet, changes in vision, blurriness, headaches, especially severe headaches. Those are signs of preeclampsia, and you definitely need to be checked out. Vaginal bleeding, it can be normal in pregnancy, but it also could be a sign of something more serious like miscarriage or placental complications. So give your doctor a call and get checked out with any vaginal bleeding. I know I gave you quite a lot of information. I just wanted to check with you. Do you have any comments or questions or concerns? Okay. Well, I'm going to be checking with your provider after this. And I'm going to definitely chart that I gave you all of this education. I'm going to go ahead now and just do hand hygiene, and I'm going to make sure you're comfortable. Okay, great. And then I'm going to go ahead and exit the room and close the door behind me. Thank you.